Scapula. The scapula is also known as the shoulder blade. It has two surfaces, three borders, three angles, and three processes. Surfaces include costal surface and dorsal surface. The costal surface of the scapula faces the rib cage. The costal surface is concave. It is also called the subscapular fossa. The subscapularis muscle takes origin from this fossa. The serratus anterior muscle is inserted along the medial border of the costal surface. Originating from the superior-lateral surface of the costal scapula is the coracoid process. It is a hook-like projection. The pectoralis minor attaches here, while the coracobrachialis and biceps brachii muscles originate from this projection. The dorsal surface, a prominent spine, divides this surface into a smaller upper supraspinous fossa and a larger infraspinous fossa, giving origin to supraspinatus and infraspinatus muscles respectively. The dorsal surface of the scapula faces outwards. It is a site of origin for the majority of the rotator cuff muscles of the shoulder. It is marked by spine, the most prominent feature of the posterior scapula. It runs transversely across the scapula, dividing the surface into two. Acromion, projection of the spine that arches over the glenohumeral joint and articulates with the clavicle at the acromioclavicular joint. Infraspinous fossa, the area below the spine of the scapula, it displays a convex shape. The infraspinatus muscle originates from this area. Supraspinous fossa, the area above the spine of the scapula, it is much smaller than the infraspinous fossa and is more convex in shape. The supraspinatus muscle originates from this area. Borders are the superior border, the lateral border, and the medial border. The superior border, thin and short, presents a suprascapular notch which transmits suprascapular vessels and nerve. The lateral border is thick at the upper end. It presents the infraglenoid tubercle. The medial border is thin. It extends from the superior angle to the inferior angle. Angles are the superior angle, the inferior angle, and the lateral angle. The superior angle covered by trapezius muscle, the inferior angle covered by latissimus dorsi, and the lateral angle is broad and bears the glenoid cavity. Clinical anatomy. Winging of scapula. Paralysis of serratus anterior muscle causes winging of scapula, in which the medial border stands out.